Hello, my name is Melina Pizzotti, and I'm a student in the Masters of Science in Athletic Training program here at the University of Texas at Arlington. And my level 3 case report was over a female basketball player with a patellar tendon tear from a patellar bony outgrowth. So a little bit of background on this pathology is that it's one of the more common injuries in the knee, and it's usually due to a chronic MOI. There are several surgical interventions for this pathology, and it usually happens in older populations. So a little bit about the patient that I used for this case report is that she was a 19-year-old collegiate female basketball player. Her initial complaint was sharp pain while running and during squatting drills, and the pain gradually got worse over time. She was previously diagnosed with a patellar tendon tear in her right knee due to a chronic MOI, and her surgical repair was 30 months prior to this left knee injury. This left knee injury was due to a bony outgrowth on the left patellar apex, and there's an unknown cause for this bony outgrowth, and her physician diagnosed her with a patellar tendon tear due to that bony outgrowth. So her interventions for this pathology was that 2 months after she got her diagnosis and MRI, she received surgical intervention and her tendon was sutured and the bony outgrowth was shaved down. Her rehabilitation was over the next 5 months post-surgical intervention, and there was a 6-week break period in that 5 months. And this break period was due to the COVID-19 protocols at the beginning of 2020. So a little bit of comparison and outcome with this patient was that patellar tendon tears usually happen in older populations, happen in both knees, and the MOI is usually unknown. The patient's pain post-surgery with the patellar outgrowth in the left knee was more painful than the post-surgery in the right knee with patellar tendon tear. And a similar case in the literature with a bony outgrowth, it took 4 months to gain pain-free range of motion. So conclusions for this pathology is that in most cases with an MOI that has a chronic issue, was that it usually takes 6 months to recover and return to play. And literature that has a patellar tendon tear with an inside mechanism, like a bony outgrowth, usually takes 4 months. And this case took 5 months with a 6-week break period. So the clinical bottom line is that this case took longer than average recovery for this pathology because of that COVID-19 protocol in the beginning of 2020, but it was shorter than a chronic patellar tendon pain recovery. And here are my references, and here are pictures of a normal patellar tendon tear suture. And if you have any questions, please let me know. Thank you.